if you're watching the Olympic Winter Games, you might have heard of this discussion that people are having about the injection of hyaluronic acid in the competitors' penises so that they can have a larger suit and therefore fly more. Now, is that for real and is that possible? That is what I'm going to explain to you in today's video. And if you like my videos, please don't forget to hit the like and subscribe buttons. So now this is the discussion. I found this image here on X and I found it interesting. They were saying, oh, this is the next winner for ski jumping. And the case here is that allegedly some competitors are injecting this hyaluronic acid in their penises in order to enlarge their penises. And by doing so, they will be able to wear a larger suit, and a larger suit would give them a competitive advantage. Now, the Federation of Ski Jumping, they are very strict about the suits that you can wear while you're doing this sport. And from what I've read, men can only have 3 centimeters below the size of their, you know what? Otherwise, this extra fabric would give them an unfair advantage. So let's look here from the perspective of a sugar glider. How it goes. So it's similar to a flying squirrel, and then it stretches their arms, their legs, and they have this kind of skin attaching the arms and the legs, and then they glide. They're not flying, they're gliding. Now what happens here when you are ski jumping is kind of similar. So let's look here. They're going full speed, very, very fast, and then they take off. And while they are flying, it's like a flying squirrel. So the more fabric they have, especially here in the crotch area, the further they will be able to fly. And that's how it goes. And then they land and you measure how much they went. Now, if they are actually, the athletes, if they are actually doing that or not, there's actually no way to know, because it's not like a drug that you can measure on a blood test. You either ask them, okay, are you doing that? Or you ask their wives, or you do an MRI of their groin. And if you find something there, then they probably had it. But can that actually work? Does it make sense? And that's what I'm going to show you here in this video. Now, hyaluronic acid, it can be used in joint injections. So we use it on shoulders, knees, especially hips, ankles. We use it in joints that are arthritic, older joints that are hurting, that are wearing off, but you don't want to do surgery right now. So you do this injection and it relieves the pain. Also, you can do that in dermatological procedures and skin procedures. If you have some scar that you don't like, you can use that as a filler, and also you can draw your jaw and put it on your lips so you look more, whatever you want to look more. But what about in the penis? Do people do that? Yeah, some people do that. And here's how it's done. So you have here this carrot and you have the condom around the carrot. Now the condom, it represents the skin, and we're going to inject the hyaluronic acid underneath the skin. And then you're doing that, you're injecting, and you want to be homogeneous. You don't want to be one part to be bigger than the other one. So you want to spread that, and that may enlarge your penis. And by doing that, when the Ski Federation scans your body to see how tight your clothes are going to have to be, they're going to measure, they're going to put more fabric in your crotch area, and therefore that can give you an advantage while you are ski jumping. I hope that was useful for you, and I hope you enjoyed this, and see you at your next appointment.